Mr. President, I would like first of all to give my congratulations to my friend, my big friend, the President Javid Afsi and Mr. Levant for this excellent Congress, very important Congress of laparoscopic surgery. We talk about problem of hernia. That's why I think that I'll talk about complications, but it's important to have some association who interested by this pathology. Complications of hernial surgery are acute and chronic complications. Acute complications, bleeding, and sometimes we are called by young surgeons because they have vessels in open surgery, taken when doing repair of hernia, trauma, organs, digestive tract, spermatic cordon, vascular, and nervous trauma and disease, neuroma, and sometimes you must go back a second time to take off a black mesh because nerve is taken. They took it when they do plaque. Nerve branch pain, seroma, and it's very important, especially by laparoscopic way. Seroma gives it's difficult in 2 or 3 weeks to be away. Infectious abscess and mesh migrations. Chronic complications, especially recurrence, primitive or secondary recurrence, residual pain, and causes of recidive, of recurrence are closure under tension, abdominal hyperpressure related to obesity, obstructive neuropathy, pleuropulmonary and anorectal pathology, acid and pregnancy. And we know that there are 2 types of hernia pathology and hernia symptom. And we have usually, we do bilan before operating hernia to know if there is something inside, and hernia is the symptom of these pathologies. Other causes, defective parietal repair, and sometimes we go a second time because first time it was bad repaired. Quality of existing tissue, infection of repaired wall, and especially with advances, age, malnutrition, immune defect, and corticotherapy. Recidive is a function of surgeon expertise and experience, and in some countries and then for some special association of hernia, we talk about specialized in hernia surgery and laparoscopic hernia surgeon. That's why learning curve is very important, and we have 300 cases to 250. The most experienced surgeons have less than 5% of residents who have this number of hours learning. It's very important to learn because we see in our departments, the hospital, the young surgeon, resident begin not very late, begin usually 2nd, 3rd year of residence, doing cure of hernia, and is not a good thing. They must be department learning on animals, and we'll do it. I'll talk you about that for training for cure of hernia. Open surgery, less than 500 of recurrence, and everybody talks about highest test of recurrence, laparoscopy in experienced surgeon. Infection is very important, not to infect mesh and to infect these area, 3 or 5%, high difference in old people, complicated when strong and engulfed hernia, delayed time of operation when it is engulfed, smokers and obesity. Infection appear around the second postoperative week and increase the risk of recidive, risk of destabilization of the mesh, suppression or deep infection, and also talk about mesh. What's the becoming of the mesh? The fibrosis of tissue, but sometimes there is visceral erosion and migration to adjacent tissue. That's why never put mesh with usual way inside peritoneum, because we have seen mesh going inside bowel and doing occlusion, visceral erosion and migration to adjacent tissue, and intraperitoneal adhesion, the obstruction of small bowel. Laparoscopy reduces the risk of parietal infection, but there is no difference, significant difference of postoperative pain, short and long term. Laparoscopy reduces duration of hospital stay. The cost is higher than open way. Thank you. But that's why the second part of my what I would like to say, that it's very important to have institution occupied with hernia. That's why there is, you know that there is 5 important departments of hernia: American Hernia Society, European Hernia Society, Australian Hernia Society, and there is Afro-Middle East Hernia Society, with 16 countries, and interesting of hernia. We have in Tunisia, Tunisian Hernia Society, and will now General Secretary in Tunisia will do in December 2020 a very important Congress, International Hernia Congress, and we have friends, and we talk to Professor Afsi and Bijan Gavabi with George Chimsit, and will together organize with other colleagues of Africa, of Europe, this very important Congress. Will do papers to have, it's very important to have in a study randomized with double aveugle for this kind of pathology. It's very important to have a consensus and to go with something studied, but not do by other people. Thank you.